Lucky Land Slots, you can get lucky just about anywhere.
Dearly beloved, we are gathered here today to... Has anyone seen the bride and groom?
Sorry, we're here. We were getting lucky in the limo and we lost track of time.
No, Lucky Land Casino, with cash prizes that add up quicker than a guest registry.
In that case, I pronounce you lucky.
Play for free at LuckyLandSlots.com. Daily bonuses are waiting. No purchase necessary. Void where prohibited by law. 18+. Terms and conditions apply. See website for details.
Hey all, welcome back to the Real Life Pharmacology Podcast. I'm your host, pharmacist Eric Christensen. Thank you so much for taking the time to listen today. Always remember, head to reallifepharmacology.com, grab your free top 200 study guide, just a little item I put together. It's a 31-page PDF, so it's definitely significant. Good little review if you're taking board exams or just want a quick refresher on the top 200 drugs and common effects there. So the drug of the day today is Dapagliflozin, or Farxiga. And this medication is what's called an SGLT2 inhibitor. And this medication is used to manage diabetes primarily. And I'll get a little bit more into the indication here lately, because this is one of the reasons I'm tackling this drug, is we've had some recent updates. So mechanistically in diabetes, how does this medication work? Essentially, it reduces the reabsorption of glucose back into the body. So it blocks that reabsorption of glucose back into the body. And what that means is lower blood glucose, like when a patient tests their blood sugar. And it also means there's more glucose in the urine. I'll talk about that a little bit as far as adverse effects. So that's how it lowers blood sugar. However, there is one particular alternate mechanism that this medication has, and it also reduces sodium reabsorption. So if you remember sodium, excessive intake and excessive water that stays with that sodium can be a big issue in something like heart failure. So by SGLT2 inhibitors like dapagliflozin, reducing sodium reabsorption back into the body, water can go with that. So these drugs also have a mild diuretic type effect, which, as you can imagine, what condition do we use diuretics in? Of course, that's heart failure. So recently, the FDA just approved, this is in 2020, if you're listening to this later on, just approved dapagliflozin for the use in heart failure in patients with reduced ejection fraction. So this is definitely something that is very, very new. We don't have really many diabetes drugs that are used for other indications other than if the patient has diabetes, kind of a comorbidity type situation. So this has actually been an approval just for heart failure with reduced ejection fraction, okay? So patient doesn't have to have diabetes to potentially show benefit in reducing cardiovascular death and hospitalization. So kind of a unique situation that we've had here with dapagliflozin, because we've seen in previous studies that patients with heart failure and diabetes, we've reduced some of the hospitalizations and things with heart failure, but that's been in combination when they've had both heart failure and diabetes there. So getting into this drug a little bit more, so obviously lowering blood sugar, talked about how that's done, and also with its diuretic effect, how that potentially could be beneficial in heart failure there as well. Adverse effect profile. So thinking about the mechanisms and how these drugs are beneficial, there is potential harm there as well. So if we increase glucose into the urine, or sugar into the urine, that provides an environment for growth of bacteria and fungus and things like that. So urinary tract infections, genital infections, patients are at higher risk for these infections. So that's a really potentially negative downside to these medications. The other thing, when we reduce fluid, when we kick out sodium out of the body, that could potentially lead to lower blood pressure. Now, this definitely could be a good thing in some patients, but in a frail 75-year-old with low blood pressure already, that's a potential risk. So, got to keep tabs on any type of genital type infection, urinary tract type infection. Got to keep tabs on blood pressure as well. Other kind of rare things that have been reported, patients have run into ketoacidosis, or maybe the risk of that is slightly greater in certain situations. I definitely think about patients that may be at higher risk already. That may compound that risk for ketoacidosis. So patients with, a history of heavy alcohol use, that have been under severe stress or maybe had a recent surgery. So those are some kind of risk factors that may increase that risk for ketoacidosis. There have been other associations with, varying degrees of evidence, bone fractures, limb amputations. Again, very, very limited evidence of causing these type of issues. The limb amputation specifically has been more so associated with canagliflozin, but as far as the SGLT2 inhibitors go, you may hear this stuff from patients. So it's important to kind of be armed and ready to combat those questions, because patients definitely will bring those to your attention there. One other thing I wanted to mention was about the kidney. Remember that these drugs are actually working in the kidney, okay? That kidney's that filter of the body, and if that kidney is not functioning very good, obviously the blood glucose lowering effect might not be that great in a patient with poor kidney function. So typically recommended to absolutely avoid this medication with an eGFR of less than 30 mils per minute. Okay, so I think that kind of makes sense in where these medications work as far as the kidney goes there. All right, so let's take a quick break from our sponsor, and we'll finish up with drug interactions. If you're in the market for pharmacist board certification study material, definitely head on over to meded101.com/store. We've got pharmacotherapy, ambulatory care, medication therapy management, geriatrics. We've got, question banks. We've got lectures. We've got all sorts of different study resources and materials there to go check out. In addition, if you're a student, we've got some NAPLEX materials as well, linked up at rxgrad.com. So definitely go check that out. Again, all those links, meded101.com/store. If you're a healthcare professional looking for more content on drug interactions, case studies, just learning pharmacology in general, again, we've got more resources at meded101.com/store. Go check those out. Support the sponsor. Help keep this podcast free and educational for all to enjoy. All right, so finishing up on drug interactions, first thing I kind of think about is additive effects. So diuresis, we kind of mentioned it's kind of got a mild diuresis. So any drug that lowers blood pressure could potentially have a little bit of an additive effect. Same thing with the diuresis effect. Adding these on to loops or thiazides, we may get a little bit more potent diuresis type effects. So you may need to keep tabs a little bit on electrolytes and things of that nature, which, if you're on diuretics, you're going to be monitoring those things anyway, kidney function, your sodiums, your potassiums, and all that good stuff. Another adverse effect, drug interaction that I think about is opposing effects. So if we're using this medication, dapagliflozin, in diabetes, we got to think about opposing blood sugars. So drugs that are going to raise blood sugars. So, your examples being your prednisones, dexamethasone, your steroids, for example. Other things, if we're using this medication for the newer indication of heart failure, you got to think about some of those meds that contribute or could exacerbate heart failure and oppose the potential beneficial effects. Most common class that I see used are ibuprofen, NSAIDs, that class of medication there. Additive blood sugar lowering effect. So a little bit more caution as far as hypoglycemia risk in patients already on your insulins and your sulfonylureas, so it's important to think about that. So again, we're going to do that through monitoring blood sugars anyway, likely, unless obviously we're just taking it for heart failure and the patient's not on either of those type of agents. One last interaction thing I did want to mention is, as I'm looking through a medication list, if I notice that the patient's on immunosuppressives or they have some sort of transplant or anything like that, these patients may be more at risk for those urinary tract infections, those genital type infections. So very, very important to think about that. If you see your tacrolimus, your cyclosporin, maybe some of the agents for, in autoimmune disorders like rheumatoid arthritis, so your infliximabs, your monoclonal antibodies, drugs that potentially suppress the immune system could potentially make it more likely for some of those infections to happen based on account of dapagliflozin use. There. So definitely think about those immunosuppressants in patients that have those on their medication list. All right, so I think that's going to wrap it up for today. Definitely go subscribe at reallifepharmacology.com. Get that free 31-page study guide. Leave a rating, review, greatly appreciated to all those of you who have done that already. And share us with a friend, colleague, another healthcare professional, preceptor, student, whatever. Definitely share the podcast, help us grow, and obviously help us educate more people. We greatly, greatly appreciate it. That's going to be it for me. If you want to track me down, you can find me at LinkedIn. Is probably the best way to do that. Eric Christensen, PharmD, BCGP, BCPS. And I hope you have a great rest of your day.
Diets and workouts, you've done the work, so why can't you get to your goal weight? That's because up to 70% of your weight is predetermined by your genetics. So while you've been told that it's all about your willpower, you're actually fighting your biology. Don't do it alone. Found's Doctor Design program uses medication as part of a treatment plan that targets your body's unique biological needs so that your body works with you and not against you. Take the quiz at joinfound.com to see if Found's weight loss program is right for you.